um, physical active. Okay. Studies suggest that those who are physically active at baseline demonstrate significantly better adherence to home exercises program. So in the clinic, you would be able to determine or identify these people who would probably uh, adhere to home exercises. So those having sedentary lifestyle, those who are obese, or those who are elderly, would probably have problems with home exercises program. So next is self-efficacy. There is a a measure for self-efficacy, which is self-efficacy for home exercise program scale. It's a 12-item questionnaire wherein patients are rated with their confidence on a 7-point scale, a range from 0 being not confident, 6 being very confident, and the total score range from 0, low confident, low self-efficacy, and 72 with high self-efficacy. So for a lower score, that would suggest that these people would probably not participate in home exercises program. And you would notice people in the clinic because these are the shy type of people who would not initiate any conversation, and those are people who are basically dependent in their activities of daily living. So another thing is anxiety, depression, and helplessness. So again, these factors are really important for us to identify during the first visit in the clinic, because uh, these factors plays major role in the level of energy. So you should ask the patient how they're if they're sleeping at night is not disrupted by pain. Because if it's disrupted by pain, normally the circadian rhythm is also disrupted, and that would result into depression, anxiety, and helplessness. Very important, social or family support. So according to studies, some patients believe that they would do more exercises if accompanied by someone else during their activity. So well, in the clinic, I mentioned about relationship. I mean, a while ago, I mentioned about relationship, the importance of relationship between the patient and as well as the family members. Because if most of us, like I said, most of us uh, love to do things if we are doing it with our loved ones. That's a trait, Filipino trait. So if we notice that there is lack of family support, um, then we should know that this patient would probably not respond to home exercises program. So with that, we could actually have a meeting with the family members and provide them, educate the family members as well, provide them with informations that are relevant to the patient's recovery, and as well as stress out the importance of their support for the patient to recover properly. Now for the strategies, these are what I listed to be more important. So we have here coaching, goal setting, monitoring, education, shared decision making, and the use of technology. So for see here for coaching, so let's not just be a physical therapist. Let's be a coach as well to the patient. Patient loves to be supervised, especially in doing exercises properly. In the Philippines, most of the Filipinos, especially who are living in the provinces, so in rural areas, they're not really into exercises. So it would take, a coach for them to really learn how to exercise properly, but not, hurting themselves. So I guess it's really important to be not just to be a physical therapist, but really, teach them how to do things properly, and also provide positive feedback and reinforcement. So this would translate to into greater coaching input and increased motivation um, in the patient. So when PTs, according to the study, when PTs provide positive feedback and monitor both performance of exercises and importance of symptoms, improvement of symptoms, adherence rates have been found to be higher. Next strategy is goal setting. So that we have here in the picture, SMART. So should be, S stands for specific. So goal setting, like being able to walk, that's a specific goal, and it should be measurable. So how long can you walk? How many steps? Attainable. We have to consider the patient's current condition and being very honest by not giving false sense of security uh, to the patient. So if we think that a patient needs more time, and we should not, we should not provide them with, uh, unreasonable and impractical, sense of false sense of security. And we have here, goals should be relevant. So okay, exercises that are really relevant to the patient's condition, like relevant to and related to activities of daily living or work or hobby. So like we have to know what their hobbies are, what their works are, and what do they want to do after the treatment. So our exercises and goals should be relevant to what they do in life. So next is time bound. So we have to set proper time, because if we don't set proper time, the patient would, would not would not be would not be following instructions on time, so therefore procrastinate and delay the process of recovery. So according to the study of PEAK, uh, this is a systematic review which concluded that goal setting may be effective in improving adherence to home exercises program. So here, next would be self-monitoring. Self-monitoring, according to the study of Stone, 2003. So self-monitoring is a form of measurement, yet this can in itself could be considered as an adherence facilitator. So self-monitoring, we could use calendars, task checklist, record personal performance. We could use, we could actually, use this in order to have the patient, uh, rate himself from the first day of the treatment up to probably depending on maybe on the third or fourth, depending on the patient's preference on as to when the patient would uh, would differentiate the level of recovery from the baseline up to the probably up to whatever um, treatment is, or whatever the patient's decision in in uh, in measuring self in rating himself as to how much he's progressing with the exercises. So we could actually ask the patient to use self-monitoring app. I'm not sure if that's being used already by Filipino PTs. I have not used an application app by myself, so that's probably something that we should do research in the future. We have education. So oftentimes education is multifactorial and can affect perceived barriers in the patient's belief and perceived threats. So education like pain neuroscience, pain being not just a sense but an experience. So I guess this was discussed by Dr. Hiroshi in his presentation. And according to the study of Aitken, 2015, he said that the use of varying strategies targeting patients' education, behavior modification would be suggested as most effective method of providing adherence, um, provided that it's tailored to each individual's needs. Let me drink some water first. So with education, we're not only going to educate the patient, we should also educate the family members regarding the um, importance of home exercises program and their role in the recovery of the patient. Next, we have shared decision making. So for shared decision making, I have three important things that I need to mention. First is the mission should be aligned with the patient goals. So with this, if the patient is probably elderly, around 80 years old, 75 to 80 years old, and the only goal is to walk within the house, I do think an aggressive, physical therapy is or aggressive home exercises program is needed. Probably that's one thing that we need to consider comparing to a young and healthy individual who wants to do some adventuring or sports activities. Then we have to be more flexible with our home exercise program. Next is the care should be a collaborative, coordinated, and accessible. So collaborative, that means that there should be an active participation by the patient and as well as the family members, and there's always coordination between the family members and as well as the physical therapist. So we could actually use like sending pictures and as well as videos for us to know whether they're doing the exercise or not. So uh, those are things that can be done for collaborative effort regarding patient's care. Another thing is patient and family are always included in the decisions. Um, this is very important because, like I said, in the Philippine setting, um, not all patients are actually capable of financing themselves for medical care, uh, even physical therapy care. So most of the time, um, these patients, when they are in a chronic condition, they already quit working and thus being financially unproductive, and they're just relying from the help of a relative or from someone abroad, or in a case of an elderly, they're really relying help from their children. So I guess uh, I guess whoever pays the bill should be included in the decision making. So we have here, lastly, technology. So according to the study, uh, 22 studies found out that 10, sorry, a review of 22 studies found 10 directly comparing traditional exercises programs to technology-based programs. And the results favors technology-based programs having 91% of adherence, while the traditional exercise programs have only 83% of adherence. So many of these technology-based programs are actually uh, being used in gaming software, or like I said, an application in a smartphone or watch, like the smartwatch. So like I said, I've not used that kind of approach. So probably this needs more research. And for me, I couldn't find any particular application that is specific for low back pain. So that's why I'm not really using that. Now, in the Philippine setting, uh, according to survey, or I think this is a forecast. So there is, if not everyone has access to internet. So according to this survey, there's only 74% having access to internet for the year 2021, and there is 75% having access to the internet um, in the following year 2022. So apparently there is 25%, about 25% not having access to the internet, especially in the places like the provinces, like the places where I practice. So not everybody is using the internet or having access to internet. Another thing is elderly population. So they're not really into technology. In the most of the people that are living in provinces are those who are already retired and also elderly. So again, that's an issue for technology. Next is socioeconomic status. So again, living people that are living in the in the provinces, not all, but there is a big percentage of people having low income in the provinces. So having low income, that could be an issue in the Philippines. Another thing is application specific for exercises. So I do see some application for walking, but I do not see an application specific for an exercise. Uh, so this is probably one of the things that are that that are um, that are you know that are happening in the Philippine setting. So what works for me, this might work for you as well. So in the clinic, I usually get the family involved and get the commitment of the family. So for example, during an examination, I would call a family member, especially the the decision maker. So I would ask him to to do the examination with me. So for example, if I'm doing the spring test to the back to provoke to do pain provocation, I would ask the family member to do the same, and being able to experience the the response, the patient response, probably would increase the involvement of the family member. And while doing, while doing the examination, uh, I would, you know, I would educate the family member as well as the patient. Um, so next is giving lots of education and motivation. So again, education on pain neuroscience, education on movement, and as well as the effectiveness of uh, home exercises program is very important, and not just the patient but also the family members. Set expectation. So set expectation. Well, let's see here. Okay, for set expectation. Before I start with the treatment, I would uh, you know uh, I would inform the patient that treatment can sometimes be painful, and treatment can sometimes demand some effort, like doing exercises. Low exercises, they would get some um, soreness after the exercise. Sometimes they get so tired, but however, these are all normal process of recovery. So once they know that these are all normal, they know that they would probably feel pain, and they would probably feel some muscle soreness after. Then they would not be surprised that after the therapy, instead of feeling instead of feeling uh, relief at some point, they would feel some soreness. So next we have to make an exercise as a shared activity using planned activities. So I would like I said, getting the family involved in the home exercises program. Giving them an activity that they could do together for the family and as well as with the patient, and asking them to report on a regular basis would be a good factor that can improve adherence. Only giving three simple exercises. So anything, according to the studies, any exercises that goes beyond three and beyond 8 repetitions would be discouraging to the patient, and especially for patients who are working and don't have much time in doing these exercises, and also for the elderly who could not remember all the exercises. So uh, the problem is, instead of them following the exercise program, they would not do instead because of these reasons. So only provide three simple exercises and low repetitions. And lastly, provide photos and videos. So again, I would ask the family members to send me photos and videos about the home exercise program that they did together. So, like I said, if this worked for me, this might work for you. And lastly, reflection. So, what do you think are the most common barriers in to home exercises program in your practice? What did you do to increase adherence to home exercises program? And how did it change your treatment outcome? So if you, I suggest that every time you see a patient, uh, go back to this reflection, go back to these questions. And I'm sure that you would really get, a better treatment outcome. And these are the references. Thank you for listening, and I guess I'm ready for questions.
Sir Rolly Matunggan ra ko, sir.
Yes.
Thank you so much for your questions, for your presentation, Sir Rolly. It was very comprehensive and very in in complementation to our international speakers provides a local context and a local setting of which we can apply practice on. So we do have a couple of questions. One of the questions is, I've been in clinical practice for 14 years and I learned and advised my patients with LBP to do their exercises twice a day, especially during acute subacute cases. But the rehab doctor told the patient that once a day is enough. What can you say about this, Paul?
Okay. It's different from what I'm, from where I come, because uh, I don't work for a rehab doctor, so I actually work independently. So, well, in that case, I guess